So a lot of people want to live healthier, not just longer. So it's about health span, not lifespan, right? And so mitochondrial health is becoming really popular. Cellular health is now, there's research now pointing to how cancer is a factor of mitochondrial or cellular like degradation, right? So there's a lot of companies now trying to focus on cellular health, red light therapy. There are certain supplements that can improve mitochondrial health. For example, urolithium A. Urolithium A is one of those substances that is produced in the gut, actually, and can really help with mitochondrial health. There's just so much clinical research around urolithium A that speaks to even reducing pregnancy risks like preeclampsia or gestational diabetes and things like that, preterm labor. But beyond that, the longevity customers are really kind of catching up onto the benefits of urolithium A. So there are a few companies now creating these supplements. One in particular called Timeline. They claim that only 30% of the population can produce urolithium A. Basically, it's a substance that you can get through eating a lot of pomegranates. But one can only drink so much pomegranate, right? So we actually just published that metric. So we can now measure urolithium A production in your gut. So we published that about 3 weeks ago, and we're about to do the data science on, is it true that only 30% of the population can produce UA? It's really magical, kind of like not like the whole longevity space is crazy about right now for improving mitochondrial health. The supplements being sold in this space they're so expensive. So I think like this is an example of you can do a test and see if you really need it. If you have high levels of it, you have good bacteria that can produce UA, then you may not need supplementation, right? Or maybe you are one of the 70% who don't have it and you need to take it for protecting your cellular health, mitochondrial health, and hence improving longevity. That's one of many, many other markers. Because we own our bioinformatics pipeline, we patented our analysis of the tool. And a lot of other companies, some companies that you've spoken to, they don't own their bioinformatics pipeline, so they can't move as quickly as we can in terms of creating these metrics that are based on research publications and as well as what the longevity clinics want to see.